Well, hello, everybody. Welcome to Heart Smart. This is a virtual class, meaning that you can see me and hear me, but we're not really here. We're all really somewhere else. But as the nature of our virtual program to maintain safe social distance, we're going to do our best to still make this as interactive as possible, giving you plenty of opportunities to ask questions and dialogue and basically kind of get the ball rolling as we talk about a very, very important topic, and that is the topic of keeping our hearts healthy. My name is John Redenberg. I am a dietitian and diabetes educator in the Employee Wellness Program in Jacksonville, and we're going to start a class program today that'll navigate you through some of the various risk factors associated with heart disease, but more importantly, leave you with some practical tips to minimize your risk moving forward. So this class is being offered on a weekly basis. We have all of our sessions at 12 o'clock, as many of you have received in your email, but each class is also being recorded. So if you're not able to watch live, you can see the recording. Given the nature of this virtual program and to track attendance, each class will also have just one little brief post test, nothing that's going to be too intimidating. It is open book, but we're using this just as a means to track attendance and participation in this program. So again, sit back, relax. Anytime you have any questions, just type them in the chat box. I'll open up the phone lines and the microphones towards the end. I find it's a little bit easier to keep things muted moving forward so there aren't, too many inadvertent disruptions. So I'll go ahead and hide myself out of the way here and take first a look at our agenda. So today we're going to kind of set the foundation for overall heart health, talk about how our heart works, what are some of the risk factors for heart disease, and then really kind of get you introduced to the structure of this program. You'll see on your screen all of the other classes that we have scheduled for you as we move throughout this program. Again, on a weekly basis with every session being recorded. We're going to talk about healthy habit formation. We're going to talk about nutrition and weight control. We'll look at some of the risk factors as it relates to stress and depression and its role in heart disease. We'll also spend some time with our Gator Care pharmacist who will review with you some of the common medications that you might be prescribed if you're somebody who's dealing with elevated blood pressure or elevated blood cholesterol. Then we'll finish up by rethinking physical activity and also look at some goal setting. So part of this program is for you to set your own goals of what you want to focus on when we're all done. And then after the program is completed, we'll set up a brief virtual or in person with distancing chat where we can talk about this action plan. Again, just to make sure that since this is a virtual class, you at least have an opportunity to meet one-on-one with somebody to talk about things that might be specific to just you. So again, very brief session, could be 15 minutes, could be an hour. It's really up to you. And again, there's no limit on the number of coaching sessions. So if you want a little bit more frequent follow-up, that's certainly a service that I can provide or our office can provide. Basically, we want to make sure you get the information you need to take action on your health, because we're a very available resource for all of our employees, even if you're down there in Gainesville. So from a wellness credit standpoint, some of you may be participating in the insurance plan and getting points towards your wellness credit. Participation in this program is worth 100 points towards your wellness credit. So this activity in conjunction with getting your flu shot and your health assessment will pretty much lock you into that wellness discount for next year. Now, we do want you to participate. So this is why we track completion of those quizzes. So, not just registering to sign up for the program, we want to make sure that you're participating too. So that's why it's important to complete those really brief 5-question post tests that we will send out there. So again, a little bit about the schedule. And again, what we want to do is make sure that we're offering a program that's evidence-based, looking at some of the most important targets as it relates to keeping our heart health, but also give you an opportunity to ask questions along the way just to see how what we cover today and the other classes can help you and your family set healthy and reasonable goals. So I always like to start many of these programs with just some basic true or false. So again, this is a virtual class. You might be all alone in your office. If you want to shout out the answer to yourself or say it quietly, that's fine. No judgment. No one's going to know if you get the answer correct or incorrect. But let's start by looking at some myths and facts about heart health. The first one, your heart needs 1 straight hour of physical activity every day. So, is this a myth or a fact? That is a myth. So when we look at physical activity as it relates to heart health, yes, very important that we achieve physical activity, but it doesn't have to be 1 continuous hour. So you'll learn as we move forward, just having segments of time carved out in your day can add up to the cumulative effect that'll help keep our heart healthy. And in fact, one of the most important pieces of information that you will be maintaining throughout this program starting today is a weekly physical activity tracker. I'm going to share with you a couple of different options that you can choose to track your daily physical activity. All right, very good. Next question, myth or fact, fiber can lower your cholesterol. So dietary fiber, we know it has numerous health benefits. I'd like to know if this is a myth or a fact. All right, this is a fact. So when we look at dietary fiber, specifically fiber that's called soluble fiber. So you'll find that in beans, you'll find that in oats, you'll find that in the pulp of many fruits like your apples, your plums, your pears. This type of fiber, this soluble fiber, actually binds to cholesterol in the intestinal tract and basically carries it right out of the body. So this is why diets that are good sources or provide healthy amounts of soluble fiber can help improve our total cholesterol levels. All right, myth or fact, heart disease kills more women than breast cancer. Here in October, as many of you know, Breast Cancer Awareness Month, very important that we be well aware of breast cancer, but heart disease kills many more women than breast cancer. So this is actually a fact. And if we look at it from a numbers standpoint, actually almost 50% of the deaths can be attributed to some form of cardiovascular disease. So if you look on the chart on your screen, you see 45% of deaths for women attributed to cardiovascular disease and 4% attributed to breast cancer. So again, not diminishing the importance of breast cancer awareness, but just emphasizing how heart health and heart disease prevention is even more paramount when we look at the rates of death among women. Myth or fact, you get high cholesterol just because of what you eat. Now, drug companies do a very good job at giving you the answer here. This is a myth. Yes, diet does have a big influence in our cholesterol levels, but also your weight status will impact your cholesterol levels, your physical activity levels will impact cholesterol, your age can impact your cholesterol, and then of course, genetics. But genetics is somewhat misleading because the true incidence of what we call familial hypercholesterolemia, so this is where there's a genetic predisposition to elevated cholesterol, the incidence, if you look at some of the research, is as high as 1 in every 311 cases. So although genetics does get a fair amount of the blame with high cholesterol, it really doesn't have a significant impact. And what we see mostly when we look at genetic profiles, it's not so much the genes as it is the environment. So we look at family traditions around activity and nutrition that are passed along to successive generations. That's what seems to really drive the risk. But again, moral of the story is you don't get it just from what you eat. Myth or fact, you should cut back on salt intake for heart health. We're well aware of the impact of salt in terms of the incidence of high blood pressure, but really just in general heart health, this is something that we should all be doing. So this is a fact. Now, there isn't really a specific quantity that's been established for how much sodium is considered healthy. There are some other factors there, but generally speaking, if we look at daily intakes, if you can keep it under 2,000 milligrams a day, that's a good start. People with incidence of heart disease or congestive heart failure or kidney disease may actually even need lower amounts of salt. But if we look at salt intake and heart health, it's always a good idea to choose less, because many of those higher salt foods also tend to be high in added fats too. Think of a lot of your processed snack foods such as potato chips and snack crackers and so forth. All right, so moving right along. Myth or fact about heart health: being obese is the biggest risk factor for heart disease. Many of you have probably well aware of all the different risk factors for heart disease when we look at it, like tobacco and inactivity and diet and genetics and gender. But this is actually a myth, all right? Being overweight or being obese is not the biggest risk factor for heart disease. When we look at what the biggest risk factors for heart disease, and we'll share some information later on, it actually tends to be attributed more towards incidence of high blood pressure and whether or not you are a tobacco user, not so much being obese. It is a risk factor, but not the biggest one. All right, last one. Myth or fact: to lower your chances of heart disease, even non-drinkers should drink red wine. So I think we've all heard that a little bit of alcohol may actually be beneficial for you. A lot of these studies are inconclusive or haven't established a true cause and effect relationship. There is enough data to suggest that even moderate consumption may be protective against all types of disease or death, but not enough to say, hey, if you aren't drinking alcohol, you should start to lower your risk for heart disease. What we're going to show, and I'll talk a little bit more detail about this when we talk about nutrition and weight control, is that there is what we call a J-shaped curve when we look at alcohol intake and mortality. So the people who have no alcohol intake have a slightly higher rate of overall mortality than people with moderate intake. But then when moderate intake becomes greater than moderate, the risk of disease, not just from heart disease, but all causes of death, as well as cancer, goes up dramatically. So again, moral of the story here: if you enjoy alcohol in moderation, there's no reason to quit. If you don't enjoy it, there's no reason to start either. And really, there's not enough data to suggest that one form of alcohol is any more protective than another, whether it's red wine, white wine, beer, and so forth. So again, moderation is still the key, which is 1 drink per day for women, 2 drinks per day for men. And no, you should not save these drinks to drink them all on the weekend. So that's a common question we get. So very good. Hopefully you all did fair enough so you could learn a little bit more as we move forward. Part of what we'll talk about today are just some basic anatomy, helping you understand a little bit more about what the heart does, how it operates, but really more importantly, to talk about the biggest risk factors for heart disease, what we can do about them, but also understanding the symptoms of an actual heart attack. We're seeing that more and more women, as we looked at in that initial myth or fact slide, more and more women dying from heart disease. So I want you to be at least minimally aware of what those symptoms are of a potential heart attack. So one of the things that we'll show you today is just a real brief promotional video that the American Heart Association did as part of their Go Red for Women campaign. But just to review, your heart, we all have one, located right there in the middle of your chest, about the size of a fist. Your heart is comprised of 4 chambers, and what these chambers do is help distribute blood to every tissue in the body. You can see the 4 chambers on your screen there. All in all, they're pumping out about 2,000 gallons of blood each and every day. So that pump is very important, but over time, how that pump operates can be greatly impacted by how well those arteries are functioning. So over time, whether it's related to inactivity, diet, tobacco use, or a combination of factors, as those arteries become more and more occluded, then so does our increased risk for heart disease, because the blood has a little bit more difficulty moving through the circulatory system. So basically, what our heart is trying to do is just give a continuous supply of oxygen and other nutrients to all of our vital organs, working around the clock, 24/7, delivering everything that our body needs. So getting oxygenated blood to all of our other tissues and supplying us with all the fuel that we need to be healthy. So again, basic heart function, probably straightforward to many of you, but just wanted to make sure everyone understands what we're dealing with, how big our heart is, how it operates, how the blood is distributed, and then what happens when problems start to arise. And those problems can start to rise very early in our adult lives. So on your screen, you'll see the progression of atherosclerosis, a little bit of a tongue twister there, I apologize. Gradually over time, as our arteries become more and more occluded, that's where we can see difficulties with increased risk of heart attack and increased risk of stroke. And this is the buildup of fats, cholesterol, and other substances in our body that can occur over time. And we see early streaking of plaques begin as early as age 2. So again, greatly influenced by a lot of our lifestyle behaviors. So again, this is why we target some of these lifestyle behaviors as a means to help slow down the rates of this hardening of the arteries. So this is what we're trying to do, protect against this complete blockage. So there is an ongoing tissue damage and we lose oxygenated blood supply. So we're familiar with heart attacks, maybe less familiar with stroke. So the heart attack and similar parallel to the brain would be called a brain attack. So this is a disease that's affecting all the arteries leading to and within the brain. And it is actually the leading cause of disability in the United States. So similar to when a coronary artery is blocked, when a blood vessel leading to the brain is blocked, this is when a stroke occurs. So the brain is not able to get the blood and oxygen it needs. And this is where tissue begins to die. So like a heart attack, we're not getting blood and oxygen to the areas that are needed, and damage occurs. So can damage in the brain. So this is why we always focus on being aware of the symptoms of not just a heart attack, but also the stroke. So let's look at overall rates of disease with a relationship to causes of death. I know, we hear a lot about death these days as it relates to COVID, and it's unfortunate and it can be mentally taxing, but overall, heart disease still is the leading cause of death nationwide. And you can see it in relationship to many other diseases throughout the United States. And you can see just how significant cardiovascular disease, which is a variety of disorders all lumped together, is in terms of leading causes of death. We can drill down even further and look at it from the state of Florida's perspective. So again, this is the latest information from the Centers for Disease Control and Death in the state of Florida. And you can see diseases of the heart, #1 at 46,000. For those of you that have been following closely the number of individuals who have passed away as relates to COVID-19, that number right now falls somewhere above this number. So I think the latest figure I saw was just over 14,000. So again, heart disease, the #1 killer of Americans nationwide. The good news, through education efforts, through public health policies, through more awareness, we are seeing a gradual decline in heart disease mortality trends. So here you see the graph starting way back in 1965 and the death rate of cardiovascular disease. So the blue would be males and the red would be females. As we go through time, here's where the most present data is available. It's been gradually declining. So that's good news. It's the leading cause of death still, but less and less Americans are dying from heart disease year over year. However, if we look a little bit more closely, particularly in our neck of the woods, the Southeast, we see the highest death rates for heart disease. So again, there's a lot of variables to consider on why we see these higher rates in the South. Is it diet related? Is it activity related? Is it socioeconomic related? There isn't much, there is a little bit of uncertainty as it relates to it, but we do know this. We see much higher rates of heart disease right in this little area here that epidemiologists will also call the stroke belt. So again, good news is the disease rates from, the death rates from heart disease are going down, but still more widespread in our area of the country than in any other area of the country. So let's look at the risk factors. Again, many of these might not be a surprise to you, but what I wanted to do is call attention to some of the more impactful risk factors. So everything you see on your screen can increase your risk for heart disease. Doesn't mean that if you have any of these risk factors, you're going to get heart disease, but the likelihood is much greater as you continue to accumulate risk. And really the most impactful risks, the things that seem to drive higher rates of heart disease, are what I have highlighted in red. So smoking, high blood pressure, elevated cholesterol levels, poor diet, physical inactivity. Those seem to lead the way when we look at risk factors for heart disease. Family history plays a role. As we get older, that increases our risk for heart disease. A history of diabetes can increase the risk, as can gender. And I put there, it changes with age. So younger populations, we see higher risk for men suffering from heart disease. But as women approach menopause and beyond menopause, we see the risk flip. So females end up being at higher risk post-menopause than males. Mentioned before about obesity, then of course something that we can unfortunately all relate to nowadays, and that is stress. You know, stress comes in many forms, and that's why we spend so much time in this program talking about ways to attack stress head on. Can't make it go away. A little bit of stress is actually good for our overall productivity, but there are healthy ways in which to manage it. And that's why it's such a big component of this program as we move forward with some of our future classes. So those are the risk factors. So if we dialed up and dug a little bit deeper and look at prevalence, look at all these different risk factors and how prevalent they are in just the general population, you know, smoking, obesity issues, and LDL, the quote unquote bad cholesterol, how prevalent it is. Hypertension, obviously, is very prevalent, especially as they've changed some of the guidelines for blood pressure monitoring. You see diabetes, you see kidney disease. But the very bottom of the screen, you actually see an inverse. All right, so here you see 22% getting the recommended exercise. So when we look at how prevalent risk factors are for heart disease, inactivity is the leading risk factor, because if only 22.5% are getting the recommended exercise, which is 150 minutes each week, that means 77.5% are not getting. All right, so I think I got a little typo there. Not 77%. 77.5% are not getting the recommended amounts of exercise. So lots of work to do with physical inactivity, and just getting that number up just a little bit can go a long way at protecting our hearts. I'll fix that slide. One thing I wanted to mention, I didn't share with this on the outset. After every class, everyone who's signed up for the program, you're going to get copies of each of these slides, so you can have them for your notes. You can have them for your little mini quiz that we send out, and you can have it for future reference too. So one of the little videos I wanted to show with you is actually kind of a humorous look at what happens when we're having a heart attack, making sure that people are keenly aware of some of those symptoms of a heart attack. So this is something that actress Elizabeth Banks did on behalf of the official Go Red for Women website for the American Heart Association. I hope you find it enlightening and entertaining. So I'm gonna go ahead and make sure I reshare this here.
Started out like a totally normal day.
Mom!
Okay, move objection deadline to the third line after survey.
Oh, honey, for when you always use the verb estar.
What are you doing down there? Did you finish your breakfast?
Ow!
Don't hit your brother. I mean, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Where are your shoes? Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her. Nobody move. I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? Just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
All right, so again, a little bit of a look at some of the common symptoms of a heart attack and what you should be aware of. I'm gonna go ahead and bring back my PowerPoint here. So, when we look at rates of heart disease and all the symptoms related to heart attack, being mindful of what those symptoms are, which is basically the main premise behind that promotional ad there. It's also important just to be self-aware of your own numbers. And what we've developed here is what we think are the 5 important numbers to know for a healthy heart. So again, not just one single variable, mind you, but a combination of these variables is what's really important to be aware of as we look at minimizing the risk of heart disease. And as these get measured on a semi-annual basis, an annual basis, a weekly basis, whichever is going to work best for you, depending on what the measurement is, the more aware and the more mindful you can be of your own personal risk. Because when we look at what actually drives improvement, it's that ongoing measurement. So when we're aware of something, what it is, then we can manage it. The first one, of course, is our body mass index, the relative distribution of our weight relative to our height. The second number to be aware of is your waist size, measured at your belly button. And lower risk is associated with waist size measurements less than 35 inches for women and 40 inches for men. The third number to be aware of is your blood pressure. All right, so blood pressure guidelines have changed recently, and we'll look at those in a little bit closer detail in a moment, but 120 over 80 or less is going to be the initial goal. The fourth number to be aware of is our cholesterol. So the total number less than 200, and ideally, depending on your other risk factors as far as diabetes and family history and whatever else might be a risk factor. Your doctor might treat you for an LDL to get it under 100, and may also look to have your HDL, your good cholesterol, above 40. So look at those terms on your screen, HDL, LDL. How do you remember what's what? Just think H for helpful, L for lousy. All right, so we're trying to drive up the good cholesterol and drive down the bad cholesterol. Then lastly, our blood glucose levels. So after an overnight fast, we're looking to have that number below 100. If we can keep all of these numbers within range, that's going to go a long way at lowering your risk for heart disease. But let's take a closer look. So when we look at our cholesterol levels, there is some data emerging that just because you have a normal cholesterol doesn't mean you are home free. We see heart attacks in individuals with normal cholesterol quite often, but based on the data that we have, it's still advisable to try to keep it below those ranges that you see on your screen. HDL above 60 appears to offer a great deal of protection against heart disease. And if you can think of your bloodstream as just one big gigantic Pac-Man game, I might be dating myself with that reference. Think of the HDL as the Pac-Man, all right? And the LDL as all those little dots. So the more Pac-Man you have, the more you can gobble up that bad cholesterol. So the HDL fights the bad cholesterol essentially. So therefore, the more elevated it is or the higher it is, the more protection it offers against LDL cholesterol. That's the number that seems to correlate the most significantly with hardening of the arteries. So generally desirable levels, again, can vary based on your own personal medical history, especially if you're somebody that has type 1 or type 2 diabetes. On your screen, it kind of shares with you what the makeup generally is of our total cholesterol in terms of the percentages, what they are, where it comes from, and what to be mindful of. So if we look a little bit closer, this graph might be a little bit intimidating at first. There's a lot of information on it. But what I want you to notice is as we move from left to right, all right, we're seeing an increase in the LDL, that bad cholesterol level. And also as we move left to right, we're seeing an increase in the incidence of hardening of the arteries, atherosclerosis. Okay, so again, the higher this rate goes, the more likely we're going to see hardening of the arteries. Now, again, there is some disagreement among epidemiologists saying that, okay, yes, it's more important to just look at total cholesterol and LDL cholesterol. Those are all true. However, what we know now is that if we can keep LDL cholesterol within manageable ranges, we can go a long way at minimizing the risk of atherosclerosis and keep those blood vessels healthy. So based on all the scientific evidence at our disposal, it's still the best route of action to treat LDL cholesterol to a healthy level so we can prevent the likelihood of heart disease moving forward. The other number, so again, we look at big risk factors. So cholesterol is, of course, one of them, but of course, the most influential because it affects so many people is blood pressure. So you saw before on that initial slide, it talked about the incidence of blood pressure was over 45% in most Americans. That's because the standards have been changed recently. Now 130, which used to be borderline or elevated, is considered stage 1 hypertension. So if your top number is 130 or your bottom number is above 80, we have stage 1 high blood pressure. Okay, so the normal ranges are less than 120 and less than 80 and elevated. So again, this is the new borderline, the elevated range here. And so both of these together, but one or the other can be elevated and you can fit the diagnosis of high blood pressure. So this is something that many of you know or are aware of as a silent killer, because really you could go through your day and not even be aware that your blood pressure is within this range. So if you're somebody who is on blood pressure medication and is receiving active treatment for high blood pressure, talk to your physician about home blood pressure monitoring. This is a tool that you can use to assess how things are going with your own personal treatment. The old excuse of, well, it always runs high doesn't mean it's good, all right? Just because something always has been that way doesn't mean it's going to be preferred. So be very aware of this number, both in your office visits and your visits to the pharmacy using their machines. When you're aware of this number, again, just like anything else, you can take action to help make sure that it is within a healthy range. But this is a big number to be aware of. And if you want details about home blood pressure monitoring, I can share with you some of the resources that we've used in some of our blood pressure classes. So it can be as simple as investing in your own little blood pressure machine that you can get for, under $50. And I think with a note from your physician can be reimbursable with your flex spending account. So if we look at weight, again, more than just BMI, you can use this chart and figure out what your BMI might be. So if you're 5'10" and 188 pounds, your BMI would be 27. So that would put you in the classification of overweight. And then again, the higher that weight goes, the higher the BMI, and then the higher the risk of heart disease. You can be very active. You can have a healthy diet, and your weight can still be outside the healthy ranges, and you're still actually on a better track than somebody who is at a healthy weight and inactive. So think of physical activity as the ultimate antidote for maintaining heart health. Doesn't mean we have to ignore the weight, but just getting that body moving is enough to help strengthen that heart. So it's our ultimate elixir in terms of overall long-term cardiovascular health. The other numbers, so not just so much the total weight, but also how it's distributed throughout the body. So women under 35 inches and men under 40 inches, that's what we're looking for in terms of lowering our risk for heart disease. And then lastly, and again, one of the most important factors, because it's something that's generally underreported and underemphasized in many education programs, and that is physical activity. So in addition to the PowerPoint, all the information that we shared so far, you're also going to get a PDF of a physical activity tracker. It'll look just like this. You're going to start it today. Okay, so you'll put today's date and then you're going to track your weekly activity. All right, so whatever you do, whether it's walking, cycling, jogging, whatever it is, if it's not sitting down, I want you to write it down. If you need to add lines to add more activity, fantastic. I'd like for you to shoot for a general goal of 150 minutes per week. And again, pace yourself. I don't feel like if you're somebody that's largely sedentary, now is not the time to try to join a high intensity training session. Check with your physician first in terms of getting overall clearance, but any movement is good movement for starters. I want you to get in the habit of tracking that activity. So a simple post-breakfast, post-lunch, post-dinner time walk, that would work. Going shopping and walking around outside where it's safe is going to work as well. Getting on your bicycle, whatever, walking through the park, taking the dog, whatever it is that gets your feet moving. And generally, if you can get that heart rate up, that's even better. But once you get in the habit of tracking your physical activity, you know, I'm not going to send this in as a homework assignment, but I am going to ask to look at it as we get to the end of this program, because I want you to compare your activity this week to your activity 6 weeks from now, and hopefully it's greater. Now, you're not locked into this physical activity tracker. Many of you are very aware of physical activity trackers, whether it's a smartwatch or a Fitbit or your cell phone. You can use that too. But the idea here, what gets measured gets managed. So we want to have you be comfortable with the notion of tracking your physical activity. And notice not how it just impacts heart health, but physical activity is also one of those things that we're going to stress as even more important in terms of a healthy outlet for stress. So again, covered a lot of basic, straightforward information. The purpose of today's class is just to help get everybody on the same page in terms of what we're going to be covering. Each of those risk factors that we looked at as relates to blood pressure, weight, physical activity, stress, we're going to dive a little bit deeper in successive classes. So this is more of an overview. It all starts though with healthy habits. So you're going to get a couple of homework assignments. When you get this PowerPoint, you'll see a link right here to a one-page article from the Harvard Medical School about why it's so hard to change unhealthy behavior and why you should keep trying. And that's going to be a good segue into our next talk, which is the science of habit formation. Our wellness coordinator, Karan Robinson, is going to lead that talk. So this is your homework. Read this article, pay very close attention to the stages of change and ask yourself, all right, what stage am I in? Am I ready to make a change? Am I not ready? And if I'm not ready, what's it going to take to get you there? So that is your homework assignment in addition to the post-test. But again, post-test is open book. We're using this just as a way to track attendance. If this were a live class, you would sign in a little sign-in sheet like we're all familiar with. But since this is virtual, we have to have some other way to track attendance. So that's what I wanted to cover with you today. I'm going to go ahead and unmute everybody. Let's see. I think I did unmute everybody. All right. So if you have a question, chime in now. You should be able to unmute yourself, or if you want to type it in the chat, that's fine too. So again, as it relates to all the different programs at the very end, we're going to have you set up a time to come in for some health coaching. We can do this over the Zoom lines. You can do it in our office here at Employee Wellness. I know whichever is going to work best for you with attention to distancing, or for those of you that are in Gainesville, doesn't matter to me how you want to meet, but we'll use that at the end of the program. So again, no rush to get that completed anytime soon. This is something we like to do at the very end. So any questions, go ahead and type them in now. Looks like everyone's somewhat content with what's been covered so far. I want to make sure that you're understanding that every session, like I said from the outset, in case you joined us late, is being recorded. It will be posted on the Employee Wellness website. So in your Zoom link, you'll see a link to our Employee Wellness website for the Heart Smart program. You'll find each of the recordings there. Once I get this one downloaded from Zoom, I'll go ahead and place it on there, and you'll kind of keep track, or you'll see a running track of each of those recordings. So, all right, here's a question. All right, so a question that many people have is, when we look at numbers, trying many things to lose weight, doesn't want to change. We're going to talk a little bit more closely about weight management when we talk about nutrition and weight control. There are things to be aware of that, yes, the body does lock into a certain weight and wants to defend itself against weight loss, but there are things that you can do to outsmart some of that biological predisposition. And we'll talk about that in our nutrition and weight control class. A lot of it has to do with how your meals are structured, the type of nutrients that you're consuming, as well as the available extra calories from fat and sugars and what can drive some of those cravings. So yes, it may seem like for many of you, your weight doesn't want to change no matter what you might do, but there are a few other things that we can possibly try in terms of nutrition manipulation that might actually help move that needle a little bit more. So very good question. And again, we'll get into greater detail about that moving forward. That will be our third class, I believe, on my agenda, the Simplifying Nutrition and Weight Control. And again, hopefully we'll get more information to you at that time. If it still doesn't if it's still not moving the needle, that's where we'll set up some more guidelines for you in our one-on-one session too. So, all right, very good. So again, I thank you for your time. I want to be mindful of your time and get you out of here with plenty of time to maybe go get a healthy lunch. And any questions along the way, send me an email, give me a phone call. You'll see my contact information on all the emails I've been pestering you with. I'm here to help you. Until next week, remember your homework assignment. Read that Harvard Health Publishing article. Do that post-test on Qualtrics, which you'll get the link later today. And we'll keep meeting and keep on smiling. Have a good day, everybody.